Welcome to Alimentary, the podcast series where you will learn about your amazing body, how it works, and of course why food is so important. We have our store cupboard staples at the end of each episode. We'll also learn more about lifestyle tips and therapies to help you to influence your health in a positive way. Open and honest communication with our doctors is essential so that we can help them to help us. Yet it can often feel challenging, especially given today's packed waiting rooms and the tight 10 to 15 minute windows that many GPs have for each patient. Making the most of those precious minutes means coming prepared, being clear about our concerns, and embracing a true partnership in our healthcare. In this episode of Alimentary, I talked to Dr. Gina Siddiqui, who is an emergency medicine physician and CEO of Carte Clinics in the States. Dr. Siddiqui is at the forefront of reimagining how medicine is practiced to meet today's demands. Through Carte Clinics, she's pioneered a model that maximises doctors' time for patients by combining personalised care with smart technology. Dr. Siddiqui is deeply passionate about the evolution of the medical profession. She frequently speaks on national platforms to champion positive change for both doctors and patients. At Carte Clinics, her team takes a bespoke approach to health, so similar to the precision and care seen in wealth management. And they deliver seamless and high quality care with medical expertise. Recognizing the foundational impact of nutrition, their team integrates nutrition experts as a core element of patient care. So I hope you'll join me in welcoming Dr. Siddiqui to Alimentary, and in our conversation, she shares her perspectives on empowering patient autonomy and how medicine can sustainably adapt to better support us all in the modern world. Dr. Gina, it's so nice of you to give us your time today, and thank you so much for coming on to Alimentary. So I wonder, could we start maybe with learning a little bit more just about your background and how your experience in medicine has led you to where you are today, advocating for a more personalised approach to healthcare?
Sure. And thank you so much, Lynn, for having me. This is a really great community that you've built and awesome topics that you guys covered. So honored to be here. I think the easiest thing to start with, honestly, is why I decided to go to med school. I remember very distinctly, it happened in a certain moment. I was doing research in Chile. And at the time, I thought I was going to be a journalist covering health. I really liked the idea of understanding something very well and then kind of being able to spread what I thought the truth was, and explain it very articulately. And I was in Chile with a really cool kind of hybrid hospital system that had Western medicine and traditional Mapuche medicine kind of in the same place. So patients would come there and sort of get the best of the knowledge and systems of training that were different between these two types of practitioners. And I was watching a clinical encounter happen with actually a traditional healer, not like a doctor. And this person, the patient, had come from very far away to see them. And, in the first 10 seconds of them being with each other, I just could feel this connection that they had, this like almost sacred bond. And I thought to myself, I just have to do something like that with life. And, I think now, being many years away from that first encounter, I look at, any career that you pursue and anything you do, even if it's not a professional career. And it's all about trust, We're all humans and we put ourselves in vulnerable places with people who we don't know or we don't know very well. And we put our finances in their hands, or we put our, kids in their hands, or, very, precious things. And at the end of the day, you live your life and either you're a trustworthy person who does what you said you were going to do, or you're not. And so I think I wanted to go into medicine because I saw this really cool way that with your health problems, you could go to someone who had this sacred knowledge and they help you with that. And, it doesn't matter what race you are, where you're from, what language you speak, you just can do that. And now I see that, that's a broader, more universal thing, but certainly medicine is a way to pursue that. So then I went to med school, and as anyone here, listening to this knows, going to a regular doctor's appointment is not, as sacred as that encounter that I watched always. And medical training is really not kind of what I thought it would be going into it as well. There's a lot of rules and a lot of, like this is how you use CYA, like cover your ass when you do this and that and never admit you're wrong and so on and so forth. And so for, some part of my like postgraduate and residency training, I sort of asked myself, like, Gina, were you like naive and this isn't really what practicing is like? And, just kind of just get in line and be a cog in the machine. And something just kind of clicked after COVID. I've been part of the founding teams of a few different health-related companies. And, I sort of asked myself, like, if you're ever going to go for this and try to make the system better, um, one small way yourself, when are you going to go for it? And so I started Carte Clinics, and, very quickly, when you design the business model and you're the boss who decides kind of how things are or not going to happen, I was practicing exactly the way that, I for so many years told myself was impossible. And it just is. You just have to kind of have structures in place, different incentives. So, long-winded answer, but that's how I got here.
You've obviously written a lot of articles about this topic, saying that you believe that we need to change or reinvent the relationship between doctor and patient. So that really goes back to that first encounter where you saw that it's more than noting down symptoms, prescribing medications, in line with those symptoms. It's about that human connection where maybe you can learn a little bit more about the patient and root causes. And as you say, that
Exactly.
connection. I mean, that leads on to say personalized healthcare. But do you find that maybe for a lot of, certainly in Ireland, for a lot of GPs, and I'm sure it's the same in the States, they are so busy and they only literally have a few minutes to see each patient. And obviously, most of them are absolutely brilliant, and of course, doctors are humans, so you have different personalities as well. How can you, when you develop a business like Cart Clinics, if you can define what personalized healthcare is and how do you roll that out with all of the different, I suppose, personalities that you will have? Do you can you allow more time to sit with each patient, or how did you even begin to sort of structure how you could change the nature of that relationship?
Yeah, well, many questions embedded in that.
Sorry,
Wonderful uh,
yeah.
analysis. So, yes, the United States is similar to Ireland. Primary care is very strapped on time, and honestly, all the specialties are as well. And we have an insurance-based system, so kind of what doctors feel they have time to do and what tests they feel they can give the patient and that are covered are sort of dictated by the insurance company. And there are even more extreme examples. I was talking to somebody about the system in South Korea, and there the appointments are even shorter. They're like 2 minutes a person. So certainly, I think there are types of problems and ways that pre-work can be done to make the physician's time, really concentrated on certain questions. But yes, Card Clinics is set up to spend a lot more time with each patient. Some cases when people are going through a major health event and they have really big decisions to make, we dedicate like 100 hours of physician time to one patient in a year. But I think the high level kind of observation that I've made is that um, the 15-minute or 5-minute or 2-minute appointment in medicine makes sense for certain kinds of problems, and then it doesn't make sense for other kinds of problems. So I'm an ER doctor. I worked a shift last night, and we had a little boy who fell and he broke his arm, and the diagnosis of that, reading the X-ray, and sort of explaining what has to come next, I could pretty predictably say how long that's going to take, right? Um, Another person has had, abdominal pain and chest pain that we really don't know the cause. And they came back from a doctor and were told that they may have liver failure, and they don't know why. So this is something that is going to be a much longer visit, and I really can't predict exactly how long it would take to get to the bottom of things because it kind of depends which things they say yes to and which things they say no to, right? So it sort of depends if it's like a wide cone of questions or like a very narrow cone of questions. And I think that these short appointments were set up in a paradigm at a time when we were dealing with a lot more simple questions. And now, most Americans have a chronic disease. Most people around the world have a chronic disease. We're living to be older. A lot of the easy, low-hanging fruits we've taken care of. And then, even if you don't have a diagnosis and you're just sort of thinking about how to live your life the best you can and optimize your health to do it with the other things that matter to you, we have so much more research about how that can be done. There's so many more choices that you can make. So, as the complexity goes up, it's just harder to do it in a, small span of time.
That's a really good point, actually. That yeah, of course, when these frameworks were set up, life was very different. Yeah, and as you say, inflammation is widespread.
Yeah.
All of these that things, factors that are driving these chronic conditions. In modern day life, most of us are dealing with. So actually, yeah, really good point. And we have to change these systems to suit the times, don't we?
Exactly. And
Yeah.
really two things have changed dramatically. The first thing that has changed is the diseases and the illnesses and as you said, the environment, the complexity of what we're dealing with. So I guess we could bend this as like the medical science has changed, right? So
Mm,
we have advances, we have more research, and then we have different diseases and environmental triggers in front of us. So that the medical science has changed. But the
mm,
second thing that has changed so dramatically is kind of the consumer science and our standard of living and our style of living. So before, you're on like a horse and buggy and you're traveling a day to see the doctor, but like now we have cell phones and we have monitors and we order groceries to our house and we have a different expectation for how seamless and quick things should be. And we extend that to healthcare. And it's not unreasonable to say that I should be able to text my doctor or call them or, have more convenience around the workup that I want to do, just the way as I do in the rest of my life. And
mm.
then, I know everyone is going to roll their eyes when I talk about AI because, like, every podcast kind of falls into this trap. But somebody said to me that it's sort of similar to the printing press. And I thought that was a great analogy because when the printing press came along, all of these religious texts that most of us kind of just had to trust the clerics to know because they were the only people who had handwritten versions of it and had these privileged copies um, were democratized suddenly, very quickly. And so then all of these other people who were curious about, what the Torah or the Bible or the Quran or the Bhagavad Gita actually said could actually read it. And so then when they go to the cleric, they're not just asking them to like give them a summary of a few things that they can memorize in their head. They're saying like, I have a question about chapter 3, section
Yeah.
2. It relates to my life. And the same thing is happening in medicine and in law and finance, whatever, whatever. When someone comes to me now, they aren't, I don't have a monopoly on the privileged text of medicine anymore. They have access, just like in the printing press, now you could read on your own. Now, of course, when I talked, like if I casually read a religious text and I talk to a religious expert, they have an understanding and insight that I don't. And I recognize that their expertise and like how they can interpret it, if they're smart and useful, is valuable, right? So similarly, doctors have a bigger body of context when we think about medical questions than if I like ask ChatGPT or Google something. But I think the dynamic has to change because the arbitrage of understanding and sort of where the starting point of the appointment is different. So I think those are the two reasons that, in my opinion, the 15-minute appointment, has a place, but it's a much smaller place now, and much more of the doctor-patient relationship is this longitudinal relationship building guidance kind of relationship or position.
So they're all really good points. We need to look at it with fresh eyes, really, don't we? And yes, of course, I would say to clients like Dr. Google isn't going to give you the right answers, but of course, everybody does a little bit of Googling.
Yeah.
And we do go with more questions. And I suppose that leads on to, with if we change the sort of the nature of how much a patient is involved in their treatment plan and decisions that are being made, do you find in the States that obviously you'll have a lot of doctors who are on board with that and welcome it, but then you will, of course, have some who are a bit reluctant to let go of the old, more traditional way of doing things. And of course, then, as you mentioned, AI, we have a lot more, we have things like Fitbits, we have apps and different things that can give us data about our health that we can bring into an appointment as well. Do you think that that all of that is being welcomed into the medical community?
Yeah, you're totally right. It's mixed.
Mm,
And I think some of my colleagues, their pushback on it, I sense that it's because they feel kind of trapped or constrained in their existing work environment. So they're thinking, you know, yeah, sure, in a perfect world, I would love to go through, the patient's Fitbit and their sleep tracking and their dreams, whatever. I
mm,
would love to know, I would love to have all that time, but I don't. I have 15 minutes and I have a boss, and, they feel they're kind of giving an answer from a position of scarcity of like, these are my constraints and they're immovable objects. So I think for a consumer, for a patient, you kind of just have to look at the person in front of you with whatever limitations that they have, whatever their job constraints are, and what can they do for you, you know? So are they going to, despite the constraints in the system, find a way to research the unique question that you have or support you in getting a second opinion, and basically understand from your perspective as a patient what you need to do to stand up for yourself? Or are they, not in a place to support you that way? And, I think it's healthy to not be judgmental of those people
yeah.
and kind of let bygones be bygones. But at the end of the day, I think as a patient, you have to stand up for yourself, or if it's for your kid or your loved one, you just have to make sure that the right thing is being done. And it's a big world out there. There's a lot of doctors, there's a lot of health practitioners, and you just have to find the people who get it.
Yeah, and you have that connection with. So I suppose going back to the personalized maybe health plans, factors like, say, genetics, lifestyle, family history, are any of those more important, or are they all equally important, when you're looking at tailoring a plan for a patient in your clinics?
Yeah, well, I love that you touched on those three because those are really kind of the pillars of personalized medicine, right? Where you come from, your genetics, your lifestyle, and specifically the family history is kind of like emerging of the two of those, but it's like what actually played out to happen.
Mhm.
Um, I don't think I would say any is more important or less important. I think maybe one other pillar of personalizing plans for people, I think would be kind of like knowing yourself. Um, I think not just in health or medicine, but in any domain, when people try to be the highest performing version of that in that domain, what it often hinges on is some personal insight, into like let's say they're trying to be a competitive athlete. It's doesn't have to be high tech, but they have to kind of know like how hard to push themselves and kind of have a sense within their body. And if they're trying to compete in another very saturated space and emerge as like, one of the best. They have to have an inner compass about, what their personal advantages are that they should leverage against others and so on. And I think health is the same way. And for the people that are trying to take that extra step beyond the insurance-based 15-minute appointments and they want to spend a little bit more time and energy on their health, it's really not enough to kind of um, pay some person, some really smart expert, nutritionist, doctor, whatever, to figure it out. There is some level of self-awareness, and a good practitioner will try to bring that out of you. Just how, you work with a coach and they'll sort of see things in you that you maybe didn't have as much awareness of until they showed you. So, like a health plan, you got to know yourself and what are
Mm.
the tactics you can take that you'll win at, and then what are your, Achilles heels.
And you're likely not to. So I suppose looking at, say, their values and their lifestyle, like what's going to be feasible and manageable for them to actually achieve, if you have things that they need to change in their lifestyle in addition to whatever medications they might be prescribed. But, if it's a lifestyle change, it's like, well, there's no point in telling someone to run if they hate running.
Right.
Yeah. So I suppose taking into account all of those, their preferences, values, lifestyle, taking all that into account when coming up with the plan.
Exactly. If you travel a lot, don't give someone like a suitcase full of equipment they need to do their regimen. It's not feasible. And then, I think something that we're all so crazy about CGMs and all these trackers right now, but some people, it's not good for them. It creates a lot of anxiety, or like the data is just not. That's not how they like to be given feedback.
Mm.
So I think you know, knowing yourself, or as the practitioner, knowing your client or your patient and figuring out, okay, is this the kind of person who's motivated by consistency? Is this the kind of person who's motivated by novelty? Is this the kind of person who's motivated by a social component and like having some support there? We all have love
Yeah.
languages. We also all have
Yes.
health languages, and it's none are wrong or right, but
Exactly. It's
not
as
know
you
them,
say.
it's like folly.
Exactly. It's totally individual. And actually that brings me on to genetic testing, obviously is becoming more widespread. And when you mention about the numbers on these personalized devices that people have, I think that you definitely need to know yourself in terms of, is that going to make me more stressed? If I
Mhm.
have all of this information, is it going to make me worry more, And I would say for most of us, if I look back at myself, I think that there were times when I couldn't handle the information.
Mhm.
Now I'd be lapping it up and interested because I would be in a place where I think I can make changes or whatever I would need to do. But I've certainly been, there have been times in my life where maybe I was overwhelmed by whatever issues I was trying to deal with and I just couldn't handle it. So it's probably a little bit of both with people, that maybe sometimes the data is great and we can do something with it, and sometimes we maybe need to step back from it.
Yeah, that's so insightful about the time that the person is in their kind of on their journey and like what else they're working on right now.
Mm.
I'm curious what genetic testing you find is helpful for, tailoring diets.
I wouldn't be involved with any labs who do genetic testing. I might do food intolerance
Mhm.
testing. That's probably about the height of it. I don't know enough about genetic testing I feel that I would need to probably go back and learn a lot more about it. Obviously, I know the basics of it, but
Yeah.
to be able to actually apply it in my clinic, I feel like I would need to do a whole, course in it, a bit more in depth than the knowledge I currently have. Would you use it much in your clinics?
Yeah. Well, that's very responsible and wise of you, I think, to have restraint. And I think the reason I asked is because it's a very I don't want to say contested, but I think a lot of genetic testing is hard for us to find out what is the ground truth, how actionable it
Mm.
is. So there's like, the domain of carrier screening, which is very validated, and it's information about what your prospects are for if you're building a family, or the APO genes for, your risk for Alzheimer's. But then I think from a nutritional standpoint, there's a body of genetic tests about essentially how you metabolize,
Mm.
how you metabolize, whether it's lipids or carbohydrates, or your antioxidant store that you need. For example, the MTHFR mutation.
Yes.
And I think that there's value in knowing those numbers, especially on the extremes of the bell curve. But a lot of us will land in the middle statistically, and I think some of those are harder to interpret how we use them. I think people who are unbiased, who aren't selling supplements, will sort of say that, look, like the supplements are really like the last intervention after you've made a lot of other basic fundamental changes in your diet that will, realistically actually help most of the people in that bell curve. So
Yeah.
once you've done all of those interventions and there's still some reason to sort of like make a marginal next improvement, there's a merit in that. Or if there seems to be something that's so clearly deranged that there's like a metabolic abnormality, then you pursue that. But I think a lot of people jump to it first because it's a way to spend money and it's a way to feel like you're doing something before doing some of the harder fundamentals of like do a
Yeah,
food diet for a few days, you know?
I
And
know.
that's really hard. I mean, I find it very annoying myself. So,
Yeah, it is. And you I mean, those are the fundamentals. Like, are we breathing right? Are we drinking water? Are we eating whole foods? And when you sort out those basics, that's where I try to start and then see what's left,
yeah.
and then see what symptoms are left. And if you do need to start with testing supplements and all of that after that for sure. Do you find that men and women are treated differently in the healthcare system?
Yeah, yeah. We're about a 50-50 split, actually, like
Mm,
basically exactly down the middle. Um, Definitely think that men and women are treated differently. In the ER, the most commonly cited example is heart attacks.
mm,
So when men come in with chest pain, there's sort of an immediate mobilization of resources and a higher suspicion. And women have two challenges. One is that when they express that they're in pain, it's taken with less gravity. It's more likely to be assumed to be emotional or, uh, basically just less severe. And then the second challenge is that women present with heart attacks more atypically. So they're more likely to have feelings like fatigue or abdominal pain. And so even a well-intentioned, not biased practitioner could just overlook a heart attack because they're like, oh, maybe she has indigestion or a belly problem, or she's, anemic or something. So I think that the one way men and women are treated differently is the sort of social biases that we have. And then I think patients also, drawing, I'm painting with a broad brush here, but men and women do just have different ways that they sort of will prioritize themselves, um, uh, how eagerly they will go to seek medical care versus put it off unless someone forces them. So, I think I would probably put it in the same bin as the principle that we covered at the beginning of this call, which is just you have to know who you're talking to. And
mm.
is this a person who like only will come to talk to a doctor if they're being dragged screaming? So like if they're here, something is really bad. Or is this a person who is very anxious and kind of predisposed to think that anything that they're feeling is a life-threatening emergency, and what you do as a doctor and how you work them up and how you help talk them through the decision process should be different for those.
And I suppose the issues that men and women deal with are different, especially when it comes to sort of perimenopause and menopause and
Aging. Yeah,
onwards, So yeah, so as you say, it is painting with a brush, but we all just need to learn to advocate for ourselves and learn about our health so that we can clearly, we can sort of clearly convey, what's going on with us, really, isn't it? To be taken seriously if the
absolutely.
time comes.
There's
Um,
this renaissance happening with hormones, I feel like, right
I
now for
know.
both and
Yeah,
women.
yeah, it's I mean, I don't know. I have a friend who says, look at, we've um women have been sort of surviving menopause for a long time, but I just think that probably in the last 10, 20 years, chronic stress is a lot higher than it was. And of course that impacts hormones too, and women are in the workplace more. And of course, the symptoms of menopause can impact performance in work and how women get treated in the workplace. So I don't know if it's just that it's more spoken about, more maybe it is a little bit more difficult at the moment, with all of the other stressors in the world. So many symptoms that we don't even realize are menopause related, and when you
Right. Like
know
point.
yeah. And when you
Yeah,
know that that's what it is, it's a relief because you can
totally.
kind of do something about it. So yeah,
Totally.
so it is a big issue. So when it comes to personalized treatment plans, and obviously you will advocate and welcome for patients to be involved in their treatment plan, do you ever find that a patient will come along and with say a treatment plan that they have Googled that they want, but maybe is outside of established medical guidelines? How would you handle that sort of a situation? Or do you
Mhm.
find that with the advent of Google that happens a lot?
Yeah, absolutely. I think hormones are a good example where it's sort of like the standard of care is very difficult to set, right?
Mm.
Because people are very different. And so it's like, should the standard be that every woman has hormone supplementation when she's perimenopausal? Should the standard be that she doesn't? Or should it be a choice? I think it should be a choice. And I think a lot of people now are more interested in alternative medicine, complementary integrative techniques, including some Eastern medicine approaches. Um, in the United States, there's been a lot more vaccine hesitancy and skepticism. And I think that my peers in the medical community have painted that group with too broad a brush. And a lot of those concerns are coming from, I think, a good place of inquisitiveness. And I think actually by quieting that down and not engaging with people, you're only pushing them further away. But yeah, we have a lot of clients who sort of say that, okay, at this point, I want to supplement the, conventional medicine advice we're getting from, world leading places, Mayo Clinic, Memorial Sloan Kettering, whatever, with either functional medicine techniques or, some other alternative approaches. I want to focus on diet and I want to do these things that I think are going to fix that. And all of that, I think, is totally valid.
So, in your experience, how does including and involving patients in the decisions about their healthcare, does it impact their outcomes?
Yeah, 100%. I don't think I could be more enthusiastic about the importance of people being bought into what they wanted, what they're
Mm,
doing to their own bodies. And I think a lot of people might listen to the beginning of this podcast and feel quite pessimistic that, okay, like the 15-minute appointment is broken, but like I can't even get into my 15-minute appointment. I have to wait a month for that visit. And like, how are we going to ever solve this problem? And I think the reality is that, doctors are not we're not going to become a society of 50% doctors, but everyone is going to level up their skills to close to what a doctor today knows,
yeah.
and we're going to all be teaching each other from our experience with menopause or with childbirth or with arthritis, and kind of bring back some level of peer-to-peer education on this. So
Mm,
if you feel like there's, again, going back to what we talked about at the beginning of this, there's people you can trust who you can talk to about your medical plan, how much more bought in are you going to be into actually committing to doing this stuff? Like you said, the fundamentals about your hydration and what you're eating and how you're sleeping and how you're managing your stress, those are like every day from
mm,
now until, the day you die. And so, none of us are perfect. None of us do it every, 100% of the time, but it's committing to your health is something that you have to have a lot of resolve for through many,
mm,
many ups and downs. When I talk to herbalists and people who are just really skilled with understanding natural compounds, and obviously so much of that knowledge is also like regional, like what are the plants that grow here, and what is this culture used to farm. It blows me away, and it's so different from my training background, and
mm,
uh, you can't, none of us as patients can rely on one specialty alone, right? We need all these different types of expertise. We need advice on our movement, we need advice on our skin, we need advice on our diet, we need advice on our mindset and how we sort of process stressors and communicate with others. And it's sort of like, the tent is getting bigger and doctors are just one small part of that. And as we as patients sort of start becoming educated, like, okay, the right person for me to go to for this advice actually is not a doctor, it's this other party. I think, yeah, it's just going to be better for everybody.
yeah.
And in my opinion, the doctor's role sort of needs to start evolving to help people find those other practitioners and sort of help people put together their dream team of what they need to reach their health goals. You don't really want to like say as a patient, okay, I'm just going to focus on my fertility with this person without a doctor sort of clearing you and telling you that, okay, like there's
Yes.
no anatomical issue. So it's sort
Yeah.
of like the doctor's job to kind of like in that clinic in Chile, like they would refer patients to each other, It's the
Mm,
doctor's job to say like, "Hey, I really support and welcome you. Now you've done all of the things that are medically needed to like really focus on sleep, and exercise, and these are the experts who can be there with you, every step of the way for the next couple of increments of time." while you optimize that.
Yeah, and I think it makes sense for healthcare systems all over the world as well, because if it'll take some of the pressure off too. If
Yeah.
people are getting involved in their own healthcare and res I suppose respecting the power of the small habits that they practice daily, you know, in the long run, stay well for longer. Um, and need medical support,
Yeah.
nowadays we have people who need medical support maybe for the last 10 or 20 years of their life, you know. So we want
Right.
that quality of life right up to the end. So it kind of makes sense to help relieve the healthcare system. I had a nurse on Thanasi about he talked about bowel screening, and how important that is, and really, again, another person who's really passionate about educating people like yourself, another person from the medical community, really passionate about educating patients about their own health and what to look out for and catch things early, and really just mind your gut, obviously look after your gut and it will look after you. So would you like to maybe tell us a little bit about Carte Clinics and how you operate?
Yeah, yeah, sure, sure. So high level, we have memberships for people. So people can enroll with us, and then we get to know them really well and kind of put all of their medical records and other doctors and practitioners together. We meet them all. We sort of read all the notes. We have our own team of specialists who we have review that data, and then we make a strategic plan. And then we're sort of by your side throughout the year to help you execute on that plan. So there's a concierge secretary, admin who helps schedule all your appointments and make sure all that happens on schedule. And then there's a medical team of doctors who are sort of doing research to vet all of the different suggestions and treatments and medicines you're on. And then together we do coaching and meeting with you regularly to make sure that you are achieving your goals. In line with what we spoke about, how important an interdisciplinary team is, we have nutrition help and physical therapy and coaching on every case. And then there's other types of expertise that we call in based on the unique circumstances of each client. So that's been humming along for a few years now. And what we're about to start doing is help people in a more one-off fashion. So we're launching our first, we're calling them health sessions, but it's kind of like a better version of a physical. A physical, if it wasn't time constrained, and if you could really decide the testing that made the most sense for your longevity, not sort of just what insurance told you to do. So it includes a very comprehensive movement assessment, DEXA scan, and just a couple of other markers that we think are good things to check on. So I think the future of CARD is going to be some combination of that, people who want to stay with us as members and we help them through everything for a whole year or more. And then also kind of more like we pop in, help you get your bearings, give you advice, and then, you know, uh, set you off for a good future wherever you're going to go.
Brilliant. Yeah. And is it, are they, I suppose in America, I think you call it brick and mortar
Yes.
hospitals.
Yes, this
I
is
don't know
our
where I
first
picked
brick and
that up, but
mortar.
yeah.
Exactly. Isn't
So
that a
they're all
funny
brick and
term?
mortar. Yeah.
Yeah.
So yeah. So and do you do Zoom consultations and that kind of thing as well?
Exactly. Yep.
Mm,
So the new physicals that we're doing are brick and mortar in person, and then our company has always been a virtual first remote one, so we can help people all around the world wherever they're traveling, and I think that is how we'll stay.
brilliant. That's great. Dr. Gina, thank you so much for your time and your insights.
Oh, Lynn,
And
thank
I
you so much.
think,
It was
yeah.
amazing talking to you.
My thanks again to Dr. Gina for her time and expertise. So, the store cover staple for this episode is the courgette. Now, the courgette is also called zucchini, and they are actually a type of squash from the gourd family, which includes squashes, melons, cucumbers, that type of vegetable. There are two main categories of squash. So, there's winter and summer, and courgettes belong to the summer group. So the winter varieties do have thicker skins, like you think of, say, the butternut squash, but the summer squashes are completely edible. So that means from the skin to the seeds and the flesh. We would mostly be familiar with the classic green courgette in Ireland, but they can also be found in yellow, and they often resemble cucumbers in shape and size. Courgettes originally come from Central America, where people have been consuming them for over 10,000 years. They were gradually cultivated throughout the Americas, so north and south, and then they were introduced to Europe by Christopher Columbus. Nutritionally, courgettes are made up of a lot of water, which means that they're less dense in nutrients compared to the winter squashes, but they still offer a respectable amount of potassium, carotenes, and vitamin C. So still a really good addition to your plate. Now, when we bring them home from the shop, what are we going to do with them? So the first thing we want to do is give them a good wash, because we generally do keep the skin on, and I would recommend it because obviously when we can leave the skin on, there's a little bit of extra fiber, and sometimes, a lot of the nutrients are just under the skin as well. But we do want to wash them well, and I'll put a link in the show notes with some ideas about washing them too. Now, courgettes are really versatile. So we can use them in chopped up, cubed in, say, a mince sauce for a bolognese or a shepherd's pie or a cottage pie. We can slice them or baton them to put into stir fries and any sort of a stew. We can actually cube them and put them into the oven and roast them, and they're gorgeous. And they just tend to soak up all of the flavors around them. Now, the other thing you could do is actually scoop out the seeds. You could slice them down lengthways, scoop out the seeds and stuff them, So there's so many different things that we can do. And they're fairly, they're not going to offend anybody when it comes to taste. They don't have a really strong taste. So generally speaking, you can add them into dishes and very few people will complain. And they'll cook very quickly as well. So hopefully there's enough information there to encourage you to add some more whole foods into your shopping trolley this week. Thank you for listening to today's episode. I just wanted to clarify that the podcast is for informational purposes only and does not substitute professional care from a doctor or trained health professional, nor constitute medical advice or services if you're in a position to need either. However, if you found it interesting, you can subscribe to make sure you don't miss future episodes, or sign up for my newsletter on lynsharkeynutrition.ie.